So dementia is as common as heart failure. In fact, more common. Alzheimer's, there's 5.4 million older Americans, 5.4 million Americans who have Alzheimer's disease, and 5.1 million Americans who have heart failure. So this is an incredibly common disease, and it's a disease where we don't have a lot of cures. We don't have great drugs to treat them in 2017, but they still have a lot of symptoms. They have the symptoms that are destructive not only for themselves, but also for their family members. These symptoms can be managed. They can be managed effectively and with better outcomes. The first telltale is when things aren't making sense. That in fact, you're not getting a coherent story. If people are asking the same questions over and over again, if they don't seem to be following the conversation, it's more of an inkling or kind of an index of suspicion that things just aren't quite right. Patients with cognitive impairment are frequently referred for two reasons. One reason is to establish the diagnosis. Many internists and some subspecialists are capable of establishing a diagnosis of dementia, but others don't feel entirely comfortable. So frequently a neurologist or a psychiatrist or a geriatrician can help with establishing the diagnosis. So that's a common reason to refer. Another referral we frequently make when we're not sure whether somebody has dementia or not is to a neuropsychologist who will do more extensive testing. The second big reason you would refer to a specialist is for management. And indeed, frequently it is quite complicated and time-consuming to manage dementia. We have a program at UCLA where it's a co-management program with nurse practitioners who manage the dementia, and that's been very successful.